Beta blockers, cardioselective beta blockers, they will block all the they will inhibit all the parameters of the heart, like force of myocardial contractility, stroke volume, heart rate, thereby cardiac output, and thereby decreases blood pressure. It also inhibits release of renin from juxtaglottic apparatus, and renin-induced hypertension will be inhibited. Some of the beta blockers might have anxiolytic effect, which contributes to its hypotensive effect. Now, adverse effects of beta blocker: heart block, then bradycardia, bronchoconstriction, peripheral vascular disease. This will, and sometimes maybe depression. Now, the indications of beta blockers are, there are 4 types of indications. One is CVS, CNS, endocrine, and ophthalmic. Among the CVS indication: hypertension, angina pectoris, tachyarrhythmia, myocardial infarction, hypertrophic subaortic stenosis, etc. In CNS, there is anxiety, tremor, migraine, alcoholic withdrawal. In case of endocrine, maybe hyperthyroidism, thyrotoxicosis, acromegaly, Cushing syndrome, and ophthalmic indication is glaucoma. Beta blockers is contraindicated in case of heart block and patient having any sorts of COPD, and if there is peripheral vascular disease, this drug should be avoided. Now, CCB, calcium channel blocker. There are 3 types of calcium channel blocker. Among these, vasoselective calcium channel blockers are used, and amlodipine, nifedipine. They inhibit all the parameters of the heart, thereby decreases force of contractility, stroke volume, cardiac output, heart rate. It also acts on the blood vessels, causing vasodilation, decreased total peripheral resistance. Now, the adverse effects of calcium channel blockers are bradycardia, heart block, throbbing headache, flushing of face, nausea, vomiting, ankle edema. Most commonly ankle edema. These adverse effects we can face if we use, especially ankle edema. And this ankle edema is not due to renal cause, but due to the vasodynamic problem. There is increased venous engorgement, which increases hydrostatic pressure, causing leakage of the fluid in subcutaneous tissue, producing edema. If patient raises his or her leg, keep it on pillow, then it will automatically clear up. Now, D stands for diuretics. Diuretics are the drugs that promote net renal excretion of urine. They are of several types, having severe potency, highly powerful diuretics, furosemide, moderately powerful diuretics, thiazide, and least potent diuretics is amiloride. In case of hypertension, we use thiazide. Thiazide, though belongs to diuretic family, but classically it is used as an anti-hypertensive drugs, especially for mild to moderate hypertension and especially for the elderly black patient. Thiazide reduces elevated blood pressure primarily by increasing urinary output, thereby decreasing blood volume, decreases venous return, stroke volume, cardiac output, leading to fall of blood pressure. But this effect initially occurs, but later on this adjustment occurs, but still there is fall of blood pressure. and this is due to effect on the arterioles. Thiazide, especially due to loss of sodium, it will decrease the tone of the arterioles indirectly by depleting sodium. Also directly causes arteriolar dilatation, though this effect is mild. And another thing, it decreases the sensitivity of the arterioles to circulatory pressure amine like dopamine, noradrenaline, and adrenaline. Now the adverse effects of thiazide. This is a hypokalemia, hypocalcemia, hyperuricemia, hyperglycemia, hyperlipidemia. And it also, due to hypokalemia, it will cause lethargy, muscular weakness. Sometimes allergic reactions occurs like hemolytic anemia, thrombocytopenia, agranulocytosis. Now, indications of thiazide: mild to moderate hypertension, then cardiac failure, idiopathic hypercalciuria, then then SIAD, syndrome of inappropriate ADH release, syndrome of syndrome of inappropriate ADH release. Thiazide should be contraindicated in case of diabetes mellitus. Now, for hypertensive urgency or emergency or severe hypertension, we use furosemide. Furosemide is a short-acting drug. Its action is immediate but brief. But thiazide, its action is slow and sustained. That's why thiazide is used as classical antihypertensive, though belongs to diuretic family. And furosemide is a powerful diuretic. Now, the most important thing for examination purpose, the differences between thiazide and furosemide. Both the drugs are synthetic. Thiazide onset of action is slow but sustained, and furosemide onset of action immediate but brief. Thiazide acts on the early part of the DCT, but furosemide acts on the thick segment of the ascending limb of the loop of Henle. Thiazide belongs to moderately powerful diuretics, and furosemide belongs to highly powerful, highly efficacious diuretics. Furosemide interferes sodium chloride co-transport, but thiazide interferes sodium potassium 2-chloride co-transport. Thiazide is moderately powerful, acts on cortex, but furosemide acts on the medulla. That's why it is highly powerful and it interferes the renal concentrating mechanism. Thiazide causes tubular reabsorption of calcium, but furosemide causes tubular excretion of calcium. That's why in idiopathic hypercalciuria, thiazide is used, indicated, and hypercalcemia, furosemide is indicated. And in case of diabetes, nephrogenic diabetes insipidus, thiazide is indicated, and furosemide is indicated in renal shutdown. Furosemide is indicated in SIAD and renal shutdown or acute renal failure, because furosemide increases GFR, but thiazide on the other hand decreases GFR. And because of this reason, thiazide is used in nephrogenic diabetes insipidus. And there is another toxic effect of thiazide and furosemide is more or less same, but furosemide causes hypovolemic hypotension, and it interferes. It may produce temporary deafness due to decrease in the concentration of the lymph node in middle ear. Another drug that is weak diuretics is amiloride. They are not amiloride, triamterene. They are not used as classical diuretics, they are used along with either thiazide or fusimide to counter their hypokalemic effect. Now, the important thing is for pregnant mother, hypertensive therapy, drug therapy for pregnant hypertensive mother. In case of pregnancy, we have to consider fetus first, and fetus safety is the prime objectives. We have to remember that, and for that situation, drug of choice, number one drug of choice is levetiracetam. Previously, the drug of choice was alpha-methyl dopa. It is a prodrug, but nowadays we prefer levetiracetam, which blocks not only alpha, also beta. So preferred drug is levetiracetam. Then the second drug is alpha-methyl dopa. Then third drug, calcium channel blocker, can be used. And for emergency purpose, we can use, even injectable purpose, we can use hydrolazine. And in case of toxemia, having convulsion, then Maxal can be used. Beta blockers also be used, but not in first trimester. It can be used in late part. And thank you for your patient hearing.